Hello, my name is Vik Mohan. I'm a doctor. I'm the medical director at Blue Ventures Conservation, and I'm responsible for Blue Ventures' health response to the COVID-19 pandemic. Today, I'm going to talk to you about how to respond to the pandemic and share some tools, resources, ideas that I'm hoping you will find helpful. So let's start with a brief introduction to the disease. So COVID-19 is caused by a coronavirus. The common symptoms it causes, as I'm sure you know, are cough, shortness of breath, and fever. Although as the disease tracks to different parts of the world, the symptoms appear to be changing a little. However, these remain the commonest symptoms that people are reporting. However, 20 to 30% of people have no symptoms at all. Most people who acquire the disease have very mild symptoms. About 5% of people are ill enough to require hospital treatment, and about 1% of people die as a result of acquiring the coronavirus. It's a highly infectious virus. About 5% of the people who come into contact with somebody with the coronavirus, so 1 in 20 people that comes into contact with somebody with the disease will acquire the disease themselves. So that's highly infectious. And what that means is once it enters a population, if left unchecked, it will double in prevalence every 6 to 9 days. And it's that combination of it being highly infectious and it killing 1% of people that it comes into contact with that makes it such a terrifying pandemic. Now, pandemics take us back to a time when we didn't have good treatment for infectious diseases, or indeed we didn't have vaccines for infections. And so the only tools we have at our disposal to protect ourselves from the disease are tracking the virus and changing our behavior to limit the spread of the disease. So how can communities protect themselves from the virus? Well, firstly, I'll share a few individual actions that we can all take. And no doubt you'll have heard many of these before. So the thing you'll have heard lots about is social distancing, keeping 1 to 2 meters away from everybody else you come into contact with other than your immediate household. The reason for this is because if somebody coughs or sneezes, they emit droplets which could contain the virus for up to 1 to 2 meters away. So we recommend keeping a distance of 1 to 2 meters from everybody other than your immediate household. Hand washing has been shown to be a really important way of reducing transmission of the virus. And it's really important that you don't touch your face if you're concerned your hands might not be clean. So definitely don't touch your face if your hands aren't clean. Wash your hands first. And if you're going to cough or sneeze, what's recommended is to cough or sneeze into your elbow, like that. If you have a fever or a cough or breathlessness, it's recommended that you isolate yourself for 7 days. And that way, if you have the disease, you won't pass it on to other people. So what can communities do to limit the spread of the virus and to protect themselves? The first thing is to share really good information about the disease, about how it spreads, and about how communities can protect themselves, and also about how the disease is progressing in their area. And I'll share with you some tools that we've got that will help you to share good information about that. It may well be that we have to adapt community life to maintain the social distancing that will keep us all safe. So if, for example, there are gatherings which would normally require lots of people to come together, we may have to limit the size of those or stop having those gatherings altogether. And at the very least, make sure we maintain a 2 meter distance from everybody else. It may be worth ensuring that we will have adequate supplies of essential items, food items, medicines, and so on, so that if for some reason we can't get them, we have at least have enough to keep us going in the short term. And on the issue of social distancing, if we are living in remote communities, it may be worth limiting movement into and out of those communities, so as to limit the risk of the virus coming into the community. The disease primarily causes severe illness in people with pre-existing disease, such as heart disease, lung disease, diabetes, and so on, and in the elderly. So it's worth shielding those vulnerable people, as well as pregnant women. So it's worth thinking about how we can protect the vulnerable people in our communities from the disease. So linked to all of that is making sure that as communities we stay informed about what's happening and effectively coordinate with the authorities on a health response. So it's worth finding out who is coordinating a health response in your area, and where can you get good information about what's happening in your area, and how can you access help, whether that's livelihoods help, whether that's financial help, social help, or healthcare. So there's things. So to summarize, there are things that we can do as individuals, things that we can do as communities, and there are things that we can do in partnership with the authorities to protect ourselves. Now, what are the ongoing challenges and uncertainties relating to the virus and to the pandemic more generally? Well, one of the big problems that we face is that we're not adequately monitoring the spread of the disease in many countries. And so we just don't know how the disease is spreading, and we don't know if the disease is changing in the way it presents, in the sort of illnesses it causes in people. So we are dealing very much with the unknown, and we risk flying into a storm without being aware of it. So we don't know how far the virus and disease has penetrated into countries, into communities. Well, often we don't know. And so that leaves us with much uncertainty about our individual risk to the disease. Another real challenge is, how do we adapt the top-down guidance that's coming to us from the WHO, from the World Health Organization, or from governments about how to protect ourselves? Quite often the guidance that's produced does not take into account the context and individual needs of communities. So, for example, the government guidance that's been produced in the UK, I'm relatively able to adhere to that guidance because I can work from home, I can order my food to be delivered to my house, and so on. So I'm very privileged in that regard, but I recognise that so many people don't have the privilege of being able to stop their normal way of life to protect themselves. So we really have to work with that top level, top down guidance, and make it workable and make it applicable for our communities in a way that doesn't compromise our ability to meet all of our other needs, for needs for livelihood and so on. Yeah. Now, in situations where we don't know very much about how the disease is spreading, as I've mentioned, we tend to err on the side of caution as a health community, to play it safe. But we need to balance that caution with wanting to take a proportionate response, because, as I've said, locking down societies, communities, can really impact upon our ability to function and survive. So we have to balance wanting to be cautious because we don't know what we're up against, with needing to maintain certain levels of services to make sure our basic needs are met. So that's an obvious example of how we have to balance those things. So I thought it might be helpful to share a few examples of the sort of things that Blue Ventures is doing in partnership with communities to protect themselves. One of the big things we're supporting is hand washing. So in sub-Saharan Africa, for example, about 50% of the population don't have access to good hand washing facilities. So we're working with communities that we work with in Madagascar to make sure every household has access to soap and a hand washing station. we're in certain parts of East Africa, we're working with fishing communities to ensure that fisheries landing sites have hand washing stations, so that everyone who's in that area, may be coming into contact with other people or with things that other people have touched, can wash their hands regularly. Now, not only will that hopefully help to protect them against the virus, it will also have positive food safety benefits. So hand washing. Another thing we've been doing is working with communities to develop educational resources so that they better understand how they can protect themselves. So we've been adapting some nationally and internationally produced educational resources to make them applicable for communities. We've been also producing guidance on how organizations can develop cross-sector responses to the pandemic, responses that include addressing the livelihoods and health challenges posed by the pandemic. We've also developed a range of tools that can support community-based responses to the pandemic, which include health-based responses. And if you would like to see those tools and resources, we would be happy to share them with you. So later on in this webinar, I will share with you a link from where you can access all of the tools and resources that we've produced and are sharing. We'll be delighted to share them with you. And we're producing more and more, and we're really trying to produce tools that are meaningful and relevant to communities. So if you have feedback for us on the tools you produced, we would love to hear from you.